If you're treating patients with hypothyroidism or Hashimoto's and they're still not getting better despite their labs looking normal, you're not alone. We're going to talk about the root causes of hypothyroidism and Hashimoto's and what can be done about it. We're going to talk about some key clinical links between leaky gut and autoimmunity, and you're going to walk away with some actionable understanding and practical tools to improve your clinical outcome. As you're going to see, the gut isn't just about digestion. Enjoy this video. So if you remember two things in regards to our microbiome, we want to remember that there's two factors that impact the ability of those organisms, right, microorganisms, to impact our body's function. One is the amount of bacteria. The second thing is the diversity. And so the diversity is really important. It has functional capacity, systematic influence, and it's often when you read some studies on the microbiome, it's often described as a virtual organ with its own separate function. And a well-diversified gut microbiome is really associated with many protective effects. It contributes to the healthy metabolism and prevention of obesity, metabolic syndrome, and even type 2 diabetes. In contrast, if you have reduction of microbial diversity, let's say you've lost certain species of bacteria, which is well documented, it is associated with an increased risk of metabolic dysfunction, insulin resistance, even systemic inflammation. So let's take a look at an interesting image from the journal Frontiers in Microbiology. And it really highlights several health promoting outcomes that are associated with balanced gut microbiome. So you can see in the center of the picture, we have the gut microbiome, right? You can see the different bacteria and then the connection and the different systems that could be impacted by this gut microbiome. And so you can see on the top, we have the gut-brain axis, which we know now, for example, if we talk about the gut-brain axis, we know that the bacteria in our gut, that ecosystem, can stimulate and impact brain function, brain chemistry, directly through the vagus nerve and indirectly through bacterial metabolites. So you have some of these factors on the left side, and it's a little small, so I'm going to describe some of them. So for example, the bacteria in our gut can produce certain short-chain fatty acids, such as butyrate, which has an immunomodulating impact, which in other words, they regulate our immune system to reduce inflammatory response, right? They also prevent pathogenic colonization of bacteria that are harmful. They maintain and improve our gut barrier. They reduce inflammation in the gut. They support healthy digestion, production of vitamins that are essential. And we're going to talk about some of these nutrients. They also produce additional beneficial metabolites, and they support a healthier body weight. So essentially, by producing some of these metabolites, fermenting fiber and producing some of those metabolites, they can release short-chain fatty acids, and some of those short-chain fatty acids go into our bloodstream, all the way to our brain, crossing through the blood-brain barrier, and are utilized by our different body systems. So that's one axis that we, of course, dive much more in depth in the program. But on the upper left side, you can see the gut-brain endocrine axis, which is more of our focus for today's conversation. But what I want you to remember is that there's other axes, right? There's the gut-heart axis, the gut-bone axis, there's the gut reproductive axis. There's actually, just as an example, and it's really fascinating, there was a particular study that found that changes in the gut microbiome are associated with changes to the vaginal area. And there's another study that found that changes in the gut microbiome are associated with a shift in the bacteria on the skin. So just think about how would that impact a patient that has eczema or other skin conditions, maybe have repeated UTIs, for example, right? We want to think about this concept in more of a like a big picture type of an approach, right? And then, of course, we have to remember that if the gut microbiome has now shifted to become imbalanced, right, or what we refer to as dysbiosis, dysbiotic, right? Dysbiotic could be your patient have lost some of the beneficial bacteria because of diet, because they chose to have a certain diet, or they are on certain medication, right? Or they have a certain lifestyle, right? Or they now have more of the unhealthy bacteria in their gut, right? This is what we refer to as dysbiosis. And that's a very general wide term to use, right? In dysbiosis, there's SIBO, but it could interfere essentially with how our body produces, converts, and uses thyroid hormone, right? So for example, a healthy gut helps to convert the inactive thyroid hormone T4 into active form, which is T3. Now, the gut also supports the nutrient absorption. So when we're eating food that contains selenium, zinc, and iodine, which are essential for thyroid function, right? Our gut microbiome helps us to supports the absorption, right? And if you're not absorbing enough selenium, if you don't get enough selenium, then essentially that is associated with increased risk of developing higher antibodies, right? Antibodies against thyroid. If you're not taking enough, zinc is also important for immune modulation. Iodine is important for thyroid production of the thyroid hormones, right? And it also, having a healthy microbiome also helps you to regulate the immune system and reduce the risk of conditions such as Hashimoto, right? Autoimmune conditions. So again, all going back to treating the root cause. If your patient has dysbiosis, they came to see you for addressing the symptoms of thyroid. If you just prescribe them hormones and you do not look at the gut and you don't look at the other factors that are involved in that, essentially what will happen, maybe their labs over time will become normalized, but what happens to that underlying inflammation, right? That triggers autoimmunity, such as Hashimoto thyroiditis, right? And they're still not getting the right short chain fatty acid production. They're still not getting the right nutrients that are important for thyroid function, right? And this is why so many patients continue to struggle. Now that we understand the different connections between the gut microbiome and how what happens in the gut microbiome doesn't really stay in the gut microbiome.
Exactly. I like that. Yeah. So I love that you broke down the kind of good bacteria we typically see, and then also the dysbiotic picture, and how you just kind of show that overview of how the gut impacts and interacts with all these different systems in the body, including the endocrine thyroid system. So yes. So much to talk about. Okay. So we're going to talk now about dysbiosis specifically and its impact on thyroid function and nutrient absorption. So if you look at some of the emerging research, we see this highlighted connection between gut health and autoimmune thyroid diseases, which is pretty much like Hashimoto's, which is hypothyroid, and or Graves', which is more of a hyperthyroid condition. So a balanced intestinal microbiome plays a critical role in supporting proper thyroid function, particularly through its influence on the absorption of these key trace elements like iodine, selenium. So your gut is about 20 feet small intestine, and I think it ranges from like 10 to 20 depending on the person, but average like 20 feet of small intestine, and you have like 5 to 6 feet of colon. So that's a lot of space for absorption, and kind of there's also a lot of space for things to go wrong. So when you think about this picture of absorption, the gut is huge for supporting all of our body systems, especially our thyroid endocrine function. So disruption of the gut ecosystem, whether that's through dysbiosis, which can be caused by a myriad of different things, or actual damage to the intestinal lining. Think about certain medications like NSAIDs that can directly damage the intestinal lining. This disruption of the ecosystem can impair the function of surface enzymes and transporters, ultimately reducing the body's ability to absorb and utilize these nutrients effectively. So selenium in particular serves a dual role. It's not only vital for thyroid hormone metabolism, but it's also essential for regulating inflammation and maintaining the integrity of the gut barrier. So a deficiency in selenium may contribute to a breakdown in the microbial balance and increase the risk of immune system dysregulation. And then there's some really cool literature around specific pathogens that can influence or that may influence thyroid autoimmunity. There's some interesting literature around H. pylori, which is in the US like a pathogenic stomach bacteria. But in other cultures, interesting, you'll see it kind of as a commensal, just normal, if you will, bacteria of the stomach, and it doesn't really cause issues across some cultures. And then in other cultures, depending on the strain, you'll see actual pathogenic disease. So there's some correlative there between H. pylori and the possibility of it kind of elevating thyroid and autoantibodies, so potentially serving as a trigger for thyroid autoimmune diseases. And then there's some research that does not support that theory, but it's really interesting to think about microbes and how much they can influence in our body. So let's take a look at this image from a 2024 publication in the International Journal of General Medicine. And it's looking at the relationship between dysbiosis and thyroid function and dysbiosis. So we see these unfavorable changes in the gut microbiota, which is dysbiosis, can lead to thyroid dysfunction, and then vice versa. So you see your gut microbiome here. So you see malabsorption of nutrients, which we kind of talked about, that selenium iodine piece that can impact your thyroid. You see activation of this T helper 17 cell, which is pretty much a pro-inflammatory cell signaling system in the body that can be upregulated due to gut microbiome dysbiosis. That can trigger issues with the thyroid. Malabsorption of those nutrients can trigger issues with the thyroid. And then also with dysbiosis and microbiome issues, you have a reduction in that butyrate component, which is also anti-inflammatory in the system and can impact the thyroid picture. Then the other side of that, you see thyroid dysfunction, thyroid hormone deficiency can impact your gut microbiome. You see a reduction in bacterial diversity in the gut microbiome as a result of thyroid dysfunction. So it's kind of a bi-directional pathway, which is why they call it the gut thyroid or gut endocrine axis, because they both impact each other. And then if you look kind of in the center, you'll see how thyroid dysfunction, you see the arrows are pointing both ways at all times. So thyroid dysfunction can impact your immune system, which can potentiate and impact the gut permeability. So you have that leaky gut, which is back to the gut dysbiosis picture. Then the other way around, you have gut dysbiosis, maybe not related to thyroid issues or thyroid dysfunction. That can in and of itself create a leaky gut situation that can impact the immune system and then impact thyroid function. So they're both really bi-directional. The gut microbiome has specific ways it impacts the thyroid, and then the thyroid has specific ways it can impact the gut microbiome. So like what Dr. Tall was saying, when you have a patient that has any kind of autoimmune disorder, especially like a thyroid picture, you have to pay attention to their gut. You should always be looking at ways to support their gut microbiome, either through testing, diet, supplements, many ways you can do that are simple. Then there are ways you can do that are more complex, but it definitely needs to be a piece of the puzzle. Let's take a look at another image. It's a little simpler from the journal Frontiers in Endocrinology. This one's going to be more of an oversimplification of the same process. So we see that when you have dysbiosis that occurs, it can lead to, like we mentioned, increased intestinal permeability, aka leaky gut. So this is allowing microbial antigens to translocate, move across the epithelial barrier and trigger this kind of security guard system, right? Triggers your immune activation. So as we saw in the previous picture, the immune activation can contribute to the development of autoimmune thyroid diseases or by directing immune responses against the thyroid tissue. So those autoantibodies that we saw. Additionally, the gut microbiome can influence immune signaling pathways such as toll-like receptor 4, which is a huge receptor in the leaky gut world if you kind of get into that research there, and promote a shift in your T helper cell profile from T helper 1 to T helper 2. So if you are into the autoimmune space, you want to kind of dig into that T helper 1 and T helper 2 balance picture, and you'll kind of see how some of the literature talks about microbiome shifts of this the kind of immune response that lends to autoimmunity on its own. So both of those mechanisms, the toll-like receptor 4, leaky gut, implicated in the pathogenesis of the autoimmune thyroid diseases. And then you'll see to the left corner section, the SCFA, those are your short chain fatty acids like butyrate. and you see kind of the pathways for inhibiting this autoimmune process in the gut, right? So the short chain fatty acids help with strengthening your cell integrity, helps with modulating the balance of that pro-inflammatory T helper 17 cell cytokine systems, helps with protection of those pathogenic components in the gut, and also helps to inhibit inflammatory processes, because short chain fatty acids like butyrate are actually anti-inflammatory in the gut. Just showing you different ways by which the microbiome and intestinal barrier can impact thyroid. But then on the other hand, things like short chain fatty acids that you can get from eating fiber or get from supplements. I think we talked about a supplement last time on butyrate for short chain fatty acids, which is a short chain fatty acid. So if you're interested in learning more, because I could talk about this all day, about the gut endocrine axis, log into your course dashboard. We have courses like Dr. Tall mentioned, long courses on intestinal permeability, thyroid health, and so forth. So log into your dashboard in the advanced and clinical functional medicine certification program to revisit these modules.